Dr. Mads Gilbert. He's a Norwegian medical doctor, professor emeritus and author who spent years volunteering at hospitals in Gaza. Dr. Gilbert, thanks so much for joining us.
Thank you so much for having me.
Now, there is some aid getting into Gaza. The UN's World Food Programme reports that it can now supply food to up to 1 million Palestinians in the besieged enclave. What is your assessment of conditions there right now? Is there still a threat of famine?
Absolutely, and it's been going on for the better part of 2 years. So this is too little too late, because many of the medical consequences of the lack of nutrition is, of course, lifelong staining of your health. And with a population that constitutes half with children, of course, this famine, this Israeli engineered famine, has already taken severe tolls, both in number of death and also in the medical long-term consequences. So I'd like to remind you that humanitarian support is actually a non-negotiable virtue of the international society. If you have an earthquake or you have a flooding or what have you, the humanitarian support is mandatory, and you don't argue, you don't negotiate on that. But Israel, on their part, with the support of the United States, have been using this self-evident humanitarian support as a bargaining chip, and they still constrain the influx. They delay it, and they do not allow, for example, mobile homes, more tents, solar panels, and reconstruction material to enter Gaza.
I want to talk a little more about the state of healthcare in this occupied territory. I mean, the medical destruction in Gaza has been catastrophic. We've seen that Israel has leveled hospitals and clinics. It's killed hundreds of medical workers, including doctors. It's also blocked the supply of critical medical supplies, which has forced doctors in many instances to carry out surgery, sometimes amputations, many of them involving children, without the use of things like anesthetics. What is the state of healthcare in the territory?
Well, the state of healthcare is still disastrous because you have basically two large groups of patients. One group are those who have been injured by the Israeli bombing. And let me remind your viewers that since the ceasefire in October, the Israelis have been continuing the bombing attacks. The last news today is that 11 Palestinians were killed, among them 3 journalists, the last 24 hours in Gaza. So there has been more than 400 killed and thousands injured during only the last ceasefire period. So that's one group of patients who needs badly advanced surgical care. The other group is, of course, those with chronic non-communicable diseases, cardiovascular diseases, stroke, myocardial infarction, cancer, psychiatric patients, and they are also denied access to a functioning healthcare because the Israeli occupation army has so systematically, as you said, destroyed, undermined, and bombed the healthcare system. And they've actually killed more than 1,700 healthcare workers. I talk to Gaza almost every day. I had a long conversation with one of my colleagues yesterday. They do a heroic job. The Palestinian healthcare workers, the doctors, the nurses, the medical students, not at least, the paramedics, the pre-hospital and primary healthcare people. But that cannot fulfill the needs of 2 million people having been incarcerated for 2 years. And most people don't understand it. Gaza is a concentration camp. It's more than 2 million people who are not allowed to escape or to leave, and at the same time being denied food, water, medical supplies, and being bombed. So it is a nightmarish scenario that has been going on for more than 2 years now without the international community standing up to its humanitarian and international obligations of securing basic human rights for everyone, also for the Palestinian people.
How is the medical situation, the healthcare situation in Gaza being made worse by the fact that almost all the people in Gaza have been displaced at one time or another? Many people have been displaced several times, and the UN estimates nearly all of Gaza's over 2 million residents have been displaced by Israel's relentless bombing. We now have a severe winter, which has taken grip in the territory. So can that contribute to even more disease in the territory? How can that be countered?
Absolutely, you're absolutely right. And of course, I'm an emergency doctor. I live in the Arctic in North Norway. We know the consequences of hypothermia, just to have a lowered body temperature below 35 centigrades, will exacerbate, will make disease and injuries much more dangerous. For example, you bleed much more if you're cold than if you're warm. So this induced hypothermia, by denying people shelter and heating sources, by itself will aggravate both trauma and chronic diseases. In addition, the unprotected, like the infants and the children and the elders, are actually dying from hypothermia. They virtually freeze to death. And the last number from the UN updated are that 9 infants have frozen to death in Gaza since December because of lack of protection. So as a medical doctor, I know that the most important way that we can safeguard the health for the people, it's not by only fancy ambulance helicopters and very high quality university hospitals. It is the basic provision of shelter, security, water, food, warmth. If we provide that, the medical needs will be much less than if the population is exposed to this lack of nutrition, to heat, and to protection. So yes, you're right. The precondition, the sort of ramification of the living in Gaza makes the health and the chance of survival much worse than if they had been treated like decent people with equal rights. So what we see is actually a very graphic illustration of a full-blown apartheid system, because we would not have allowed any other state than Israel to treat a population of civilians in the way that the 2.1 million people in Gaza and also in the West Bank are treated currently, while the world leaders are silently accepting it because they do not put pressure on Israel.
You know, our reporter just showed us young children in a temporary tent school in Gaza. Al Jazeera reported that children have to run the gauntlet of Israeli snipers to try and get to these tent schools. They try to get to some level of normalcy for children in the territory. Talk to us about the lasting psychological, medical, and societal impact that the Israeli onslaught is having on children.
That's a very key question, because all of us who know the Palestinian people and their culture know that the Palestinian people are known for its eagerness and its thirst for knowledge. They have a very, very high level of education, both at sort of primary school, high school, and university level. And the Israelis have actually erased all the 10 universities in Gaza. According to the latest UN report, and by the way, all my numbers are from UN reporting, 63 university buildings have been completely demolished. I used to be a visiting professor at Al-Azhar University in Gaza City. It's completely gone. And the same with many of the primary schools and the colleges. So this eradication of the Palestinian education system, combined with the trauma of so many families having lost parents, grandparents, and children. Don't forget, more than 100,000 people have been killed, and among them almost 30,000 children during these last 2.5 years. This will make a massive psychological impact on the children, because the schools are not only a place for learning. The schools in Palestine, as everywhere else in the world, is a key part of the psychosocial network for children when they grow up. That's where they find the peer support through nice teachers. That's why they can sustain a lot of everyday trauma, because they have the support from that social network. So eradicating universities, high schools, and primary schools in Gaza is part of the greater picture of taking hope away from the Palestinian people, to break their backbone in order to have them to surrender. So this is all part of a very systematic, different aspects of the genocide, which aims at, of course, colonizing and displacing the Palestinian people, ethnic cleansing and genocide. That's the bottom line for all of these different actions we see. It's a system of oppression.
Dr. Mads Gilbert, thanks for joining us, sir.
Thank you so much.